Environmental toxins and their impact on health. Welcome to our channel, where we delve into the intricate world of environmental toxins and their profound impact on human health and the environment. Environmental toxins are substances present in the environment that can have adverse effects on human health and the ecosystem. These toxins can be natural or human-made and can come from a variety of sources, including air, water, soil, and food. They can have wide-ranging impacts on health, depending on their type, concentration, and exposure duration. In this comprehensive discussion, we will explore various categories of environmental toxins and their impact on human health. Before we begin, make sure to smash that like button and hit the subscribe for more exciting content. 1. Heavy metals. Heavy metals such as lead, mercury, cadmium, and arsenic are common environmental toxins. Exposure to these metals can occur through contaminated water, food, and air. Heavy metals can accumulate in the body over time, leading to various health problems. For example, lead exposure in children can result in developmental delays and learning disabilities. Mercury exposure, often through fish consumption, can harm the nervous system, while arsenic in drinking water is associated with an increased risk of cancer. 2. Air pollutants. Air pollution, stemming from vehicle emissions, industrial activities, and various sources, comprises a mixture of harmful components, including particulate matter, PM 2.5 and PM 10, ozone, nitrogen dioxide, NO2, sulfur dioxide, SO2, and volatile organic compounds, VOCs. Prolonged exposure to these pollutants can have severe health consequences. Individuals exposed to high levels of air pollutants face an increased risk of respiratory issues, cardiovascular diseases, and even premature mortality. Furthermore, those with pre-existing conditions such as asthma and allergies often experience exacerbated symptoms. It is imperative to mitigate these emissions, promote cleaner technologies, and improve air quality to protect public health. 3. Pesticides and herbicides. Pesticides and herbicides play a crucial role in modern agriculture by controlling pests and weeds, but their use raises concerns about environmental and public health. Residues from these chemicals can accumulate in food and water sources, leading to chronic exposure for both consumers and agricultural workers. This prolonged exposure has been associated with a spectrum of health issues, including an increased risk of cancer due to some pesticide compounds, neurodevelopmental disorders, and disruptions of the endocrine system, which can lead to hormonal imbalances. Striking a balance between effective pest control and safeguarding human health remains a significant challenge in modern agriculture. 4. Endocrine disruptors. Endocrine disruptors, such as bisphenol A BPA, phthalates, and certain pesticides, are substances that can disrupt the endocrine system's hormone production and regulation. Exposure to these chemicals has been linked to various health issues, including reproductive problems, developmental disorders, and an elevated risk of hormone-related cancers. As these chemicals are present in everyday products and the environment, understanding and minimizing exposure to endocrine disruptors is crucial for protecting public health and well-being. 5. Persistent organic pollutants, POPs. Persistent organic pollutants, POPs, are a group of organic compounds known for their exceptional resistance to environmental breakdown. Notable examples comprise polychlorinated biphenyls, PCBs, and organochlorine pesticides like DDT. POPs tend to accumulate in fatty tissues and biomagnify as they move through the food chain, posing significant risks to human health. These toxins have been associated with a spectrum of health issues, including cancer due to their carcinogenic properties, immune system suppression, and developmental problems. Mitigating POPs exposure and addressing their persistence is critical for safeguarding both human health and the broader environment. 6. Radiation. Ionizing radiation from sources like nuclear power plants, medical procedures, and radioactive waste can damage DNA and increase the risk of cancer and genetic mutations. Non-ionizing radiation from sources like cell phones and Wi-Fi has been studied for potential health effects, although the evidence is inconclusive. 7. Indoor pollutants. Indoor air quality is a critical aspect of our well-being. and pollutants like tobacco smoke, mold, volatile organic compounds, VOCs, and radon can profoundly affect health. Exposure to these indoor pollutants may lead to various health problems, particularly in individuals with pre-existing conditions. Respiratory issues, allergies, and exacerbation of pre-existing health conditions are common consequences. Therefore, maintaining good indoor air quality through proper ventilation and minimizing pollutant sources is essential for a healthy living environment. 8. Water contaminants. Water pollutants encompass a diverse range, from bacteria and viruses to heavy metals and industrial chemicals. Contaminated drinking water not only leads to immediate health risks like gastrointestinal infections, but can also have long-term consequences such as cancer, neurological disorders, and developmental issues. Ensuring clean and safe drinking water is essential for protecting public health and well-being. 9. Noise pollution. Although not commonly categorized as a toxin, noise pollution, stemming from sources like traffic and industrial machinery, can exert detrimental effects on health. Prolonged exposure to high noise levels has been associated with heightened stress, sleep disturbances, and cardiovascular issues. Noise mitigation strategies and awareness of its potential health impacts are crucial in addressing this often overlooked environmental concern. It's important to note that the impact of environmental toxins on health can vary depending on factors such as the level of exposure, an individual's susceptibility, and the specific toxin involved. Children, pregnant women, and individuals with compromised immune systems are often more vulnerable to the effects of environmental toxins. Efforts to mitigate the impact of environmental toxins on health include regulatory measures, pollution control technologies, public awareness campaigns, and individual actions such as choosing organic foods and reducing exposure to indoor pollutants. In conclusion, environmental toxins can have a profound impact on human health, ranging from immediate, acute effects to long-term chronic illnesses. Understanding the sources and effects of these toxins is crucial for public health and environmental conservation. Reducing exposure to environmental toxins and advocating for cleaner and more sustainable practices is essential to protect human health and the planet. If you find our videos helpful, don't forget to share, subscribe, and hit the like button to support our channel.